Eosinophils are white blood cells that play a crucial role in our immune system. They are like the body's specialized defense units, always on alert for invaders like parasites and allergens. Think of them as vigilant guards patrolling your body, ready to combat threats. In a normal, healthy state, our blood contains a specific range of eosinophils. This range can vary slightly depending on the laboratory conducting the test. However, it generally falls between 0 and 500 eosinophils per microliter of blood. When the number of eosinophils in the blood rises above this normal range, it indicates a condition known as eosinophilia. This elevation signals that the immune system is working overtime, potentially in response to an underlying issue. Understanding eosinophils and their function is key to grasping the complexities of eosinophilia. These tiny cells, while small in size, play a mighty role in safeguarding our health. Diagnosing eosinophilia begins with a simple blood test called a complete blood count, or CBC. This routine test measures the different types of cells in your blood, including eosinophils. If your eosinophil count comes back high, your doctor will likely investigate further to pinpoint the underlying cause. Determining the root cause of eosinophilia is like detective work, requiring a thorough medical history review and additional tests. Your doctor may ask about your medical history, any recent travels, allergies, and current medications. Further investigations might include stool tests to check for parasitic infections, allergy testing to identify potential triggers, and imaging scans like X-rays or CT scans to examine your organs for any abnormalities. Remember, a high eosinophil count is just one piece of the puzzle. The goal is to identify the underlying condition driving the increase and target treatment accordingly. Treating eosinophilia is not a one-size-fits-all approach. The best course of action hinges on identifying and addressing the underlying cause. Think of it as personalized medicine, where the treatment plan is tailored to your specific needs. If the eosinophilia is mild and no clear cause is found, your doctor might recommend watchful observation. This involves monitoring your eosinophil levels over time with regular blood tests. For cases where an underlying condition is identified, treating that condition becomes paramount. This could involve anything from allergy medications for allergies to antiparasitic drugs for parasitic infections. Throughout the treatment journey, close monitoring is essential to assess the effectiveness of the chosen approach and make adjustments as needed. In mild cases of eosinophilia, where the cause remains unknown and symptoms are absent, observation might be the preferred initial approach. This period of watchful waiting allows your doctor to monitor your condition without unnecessary interventions. During this time, regular blood tests will likely be scheduled to track your eosinophil levels. This provides valuable information about whether the condition is stable, improving, or worsening. Observation doesn't mean ignoring the issue. It's about gathering more information and ensuring that the benefits of immediate treatment outweigh any potential risks. Remember, your doctor will guide you through this process, explaining the rationale behind observation and addressing any concerns you may have. Medications, targeting the source. When medications are necessary to manage eosinophilia, the type and dosage will depend on the underlying cause. Medications act as targeted weapons, aiming to address the root of the problem rather than just suppressing the symptoms. For instance, if allergies are driving the increase in eosinophils, antihistamines or corticosteroids might be prescribed to control the allergic reaction and reduce inflammation. These medications work by blocking the chemicals released during an allergic response. In cases of parasitic infections, antiparasitic drugs are the mainstay of treatment. These medications work by either killing the parasites or preventing them from multiplying, ultimately reducing the eosinophil count. It's crucial to remember that medications should always be taken under the guidance of a healthcare professional. Self-treating can be dangerous and may worsen your condition. Unmasking triggers medications and eosinophilia. Sometimes medications themselves can be the culprit behind eosinophilia. This is known as drug-induced eosinophilia. In such cases, identifying and discontinuing the offending medication is paramount. Common culprits include certain antibiotics, non-steroidal anti-inflammatory drugs, or NSAIDs, and some anti-seizure medications. It's essential to provide your doctor with a complete list of all medications, supplements, and over-the-counter drugs you are taking. If drug-induced eosinophilia is suspected, your doctor will likely recommend stopping the suspected medication and monitoring your eosinophil levels. Remember, never stop or change your medications without first consulting your doctor. Tackling underlying conditions, allergies, asthma, and parasites. Treating the underlying condition is crucial for effectively managing eosinophilia. This often involves a multidisciplinary approach, addressing the specific needs of each patient. For eosinophilia triggered by allergies, identifying and avoiding allergens is key. This might involve allergy testing to pinpoint specific triggers and lifestyle modifications to minimize exposure. Asthma, another common trigger, requires long-term management with medications like inhaled corticosteroids to control inflammation and prevent asthma attacks. Parasitic infections, particularly those acquired through travel or contaminated food and water, necessitate prompt treatment with anti-parasitic medications. Remember, early diagnosis and treatment of the underlying condition are essential for preventing complications and improving long-term outcomes. Advanced armamentarium biologics and corticosteroids. In severe or persistent cases of eosinophilia, where conventional treatments haven't provided adequate relief, advanced therapies like biologics and corticosteroids might be considered. These potent medications offer a targeted approach to modulate the immune response. Biologics are a newer class of drugs that target specific pathways involved in inflammation. They work by blocking the action of certain proteins that contribute to eosinophilia. Examples include mepolizumab and benralizumab. Corticosteroids such as prednisone are powerful anti-inflammatory drugs that can effectively reduce eosinophil levels. However, long-term use of corticosteroids is associated with potential side effects, so they are typically reserved for severe cases or when other treatments have failed. Your doctor will carefully weigh the benefits and risks of these advanced therapies before recommending them. Lifestyle as medicine empowering your health. While medical treatments form the cornerstone of managing eosinophilia, lifestyle modifications can play a supportive role in improving your overall health and well-being. Dietary changes, such as identifying and eliminating potential food sensitivities, can be beneficial. Keeping a food diary to track your meals and any associated symptoms can help identify triggers. Environmental control measures, like minimizing exposure to dust mites, pet dander, and pollen, can help reduce allergic reactions that contribute to eosinophilia. This might involve using air purifiers, washing bedding frequently in hot water, and keeping pets out of the bedroom. Stress management techniques, such as yoga, meditation, and deep breathing exercises, can help regulate the immune system and reduce overall inflammation. Remember, lifestyle modifications are not a substitute for medical treatment, but rather a complementary approach to support your overall health. The importance of partnership. Your healthcare team. Navigating the complexities of eosinophilia can feel overwhelming at times. Remember, you don't have to do it alone. Your healthcare team is your partner in this journey, providing guidance, support, and personalized care. Open communication is key. Don't hesitate to ask questions, express your concerns, and share any new symptoms or changes in your condition. Your healthcare team might include a primary care physician, allergist, immunologist, or hematologist, depending on the underlying cause of your eosinophilia. Remember, you are an active participant in your healthcare. By working together with your healthcare team, you can make informed decisions about your treatment and achieve the best possible outcomes. Living well with eosinophilia. Living with eosinophilia can present unique challenges, but it doesn't have to define you. By understanding your condition, following your treatment plan, and making healthy lifestyle choices, you can live a full and active life. Remember to stay informed about your condition. Remember, successful treatment depends on proper diagnosis and individualized care. Always consult healthcare professionals for proper evaluation and treatment. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. Drop your questions in the comments below.